your response to what she had
Right,
to say?
so I disagreed with her on 2 points. First of all, they don't get better care right now. They have the same coverage, the same access to health care as average Canadians, and particularly vulnerable low-income Canadians. They have, and they are those, they have the same coverage. Come next week, they will only be able to see physicians for certain conditions that have been deemed essential or urgent by the federal government, or conditions that are a threat to public health or public safety. If, for example, a woman, she has just arrived in Canada, she doesn't want to have any more children just yet so that she can go to school and get a job and integrate her family, she will not be covered to see a physician to even talk about what her options are, let alone have the medication covered if that's what she requires. So to me, that's different than what we all get here.
And what do you make of the fact that the minister is saying that Canadians don't know the fact that refugees are, essentially getting an easier ride than other Canadians?
Well, they don't know that because it's not true. So right now, refugees get the same health care we get. Starting next week, they will get less health care. These are very vulnerable people. I work with them every day. They come from very difficult situations, and they didn't come here to get health care. They have come here to survive, and we're going to make that more difficult for them by what we're doing.
And obviously, this is, we've seen a couple of healthcare providers go to different events that ministers are having to raise concerns about this policy change or the shift. Are these protests going to continue, or how would you characterize them? Would you say that what you did today was a protest?
I was just speaking as a concerned Canadian, and I feel like there's a lot of misinformation out there, and I hope that average Canadians, that all citizens will hear what is really happening. This protest or movement by physicians is supported by many national organizations, the Canadian Medical Association, the Canadian College of Family Physicians, the Canadian Pediatric Association. I could go on and on. They have all come out and spoken out against the government. We have asked for dialogue. We've not been given it, and no input was given by healthcare providers into these changes about what would be reasonable to do.
Are you concerned that some refugees might go underground to get health care, to get medication?
What do you mean by underground?
Well, going to pro bono doctors, for instance, or finding other ways to get prescription drugs other than through the legal routes?
I suppose. I haven't really thought about it. What I'm more concerned about is that even refugees who may be eligible for coverage for a certain condition, they're really getting the message that the Canadian healthcare system doesn't care about them, and that they may not come to see a physician for a cough because they're worried that it's not covered, when that cough could in fact be something very serious like tuberculosis. That's covered, the treatment for that, but how is a refugee meant to know when they're allowed to go and see the doctor? So I'm more worried about the opposite, so people going underground and staying at home really sick.
What do you fear will happen next week?
So I think some things won't immediately be obvious. I think it will take possibly a couple weeks or months when people run out of medications, when they're not able to be seen at the doctor for certain things. But I do think people are going to become sick, and probably some people will die because of this.